My name is Eddie Chan. I'm the president and CEO of Northeast Medical Services, and I welcome you all here today. So today we really have the distinct honor of hosting an event for Assembly Speaker John Pérez and the Honorable Mayor Ed Lee. We also have the honor having the presence of Assemblymember Phil Ting and Supervisor David Chu. We thank them for being champions of our clinics and continually working to meet the needs of the most vulnerable in our community. NEMS is one of the largest community health centers in the United States, targeting the medically underserved population. In 2013, NEMS had approximately 61,000 unique patients. Of those patients, we had 300,000 plus face-to-face encounters with our doctors, nurses, and medical staff. We pride ourselves in offering linguistic competence and culturally sensitive healthcare services to the many diverse languages and dialects that our communities require. In fact, 85% of our patients are served in a language other than English, and 68% of those patients are either Cantonese speaking, 13% are Mandarin speaking patients. We are proud to provide extensive language services for our patients so that they can receive healthcare seamlessly in their native tongue. So now I'd like to turn the mic over to the Honorable Speaker, John Pérez, who will speak on the importance of language access and the efforts to improve this important issue.
Thank you so much for the introduction and, quite frankly, for the work that NEMS does every day. I am pleased to join Mayor Lee, Assemblymember Ting, and Supervisor Chu for today's event. And we're here to make one thing absolutely clear. Di dapat mawala sa pagsasalin kung tukol sa alagang kulusugan. Or put another way, no deje que el cuidado médico se pierde en la traducción. For those of you who don't speak Tagalog or Spanish, that means don't let healthcare get lost in translation. California is the nation's leader in implementing healthcare reform. More than 825,000 Californians have secured affordable quality healthcare through California, and more than 1 million additional members of our community are now eligible for newly expanded Medi-Cal coverage. But our efforts are not limited simply to expanding the scope of coverage. We must also be focused on expanding the quality of care for every patient. We have some of the best doctors in the world working here in California, but the work they do becomes much more difficult, if not impossible, if the patients they're trying to treat can't understand a simple question like, where does it hurt? When a person is unable to communicate with their doctors, the best case scenario is that they end up undergoing unnecessary tests to arrive at the diagnosis. The worst case scenario is that the patient doesn't get the right diagnosis and ends up with the wrong treatment or no treatment at all. This is not an abstract issue for us. When more than 40% of Californians speak a language other than English at home, and when 7 million Californians have only limited proficiency in English. As a state, we have more than 200 languages spoken on a daily basis. It's clear that people who need health care are facing language barriers that place their lives and their health in jeopardy. I've introduced AB 2325 to ensure that patients have access to the medical interpreters they need to receive the right treatment for their ailments. NEMS does a phenomenal job of providing culturally and languagely appropriate healthcare services, but there are so many providers throughout our state that don't have that same capacity. Whether you speak Spanish, Cantonese, Mandarin, Korean, Tagalog, or Farsi, when you're speaking with your doctor, it's absolutely critical that your doctor is able to understand and accurately diagnose your condition. That's certainly true, especially in emergency room settings, where a chest pain can be a sign of something as innocuous as indigestion or as serious as a coronary. Where accurate information is critical and every second can make the difference between saving a life or losing one. But it's also true in diagnosing chronic conditions, whether a lump is just a lump or the most visible sign of a life-threatening cancer. And right now, for far too many Californians who don't speak English with fluency, that means that someone else, and often it's their children, must act as their interpreter. No parent should ever be forced to relay complex and often very personal information through their children because they're unable to speak the same language as their doctor. And no child should ever be forced to act as an interpreter when doctors are asking deeply personal but absolutely vital questions that children are neither equipped to understand nor should be expected to hear. We need to ensure that hospitals can deliver the best care possible to their patients, and that means we need qualified and trained interpreters on staff to ensure that patients can ensure doctors have the information they need and patients get the care that they deserve. AB 2325 is a smart investment in healthcare for California because the vast majority of funds available come from the federal government. In fact, we get a 3-to-1 federal drawdown for every dollar we spend here, meaning that we can strengthen our economy and improve healthcare outcomes without significantly impacting California's budget. This is a critical issue for a large and diverse state, and we will help ensure that no person's health care will be lost in translation. With that, I'm pleased to introduce the Mayor of the City and County of San Francisco, the Honorable Ed Lee. Mr. Mayor.
Thank you. Good morning. I am really excited about this, yet another great opportunity to work with Speaker Pérez on this important issue. Let me first of all say that I often speak, and along with Board President David Chu and Phil Ting and others who've worked here locally, we often speak about our city's strength, its diversity. Well, that diversity, whether it's here in San Francisco or as Speaker Pérez has noted, a strength throughout the state, that will not be a strength unless there's adequate communication. And particularly in the areas of public safety, emergency services, and healthcare. This particular bill makes yet another strong effort to make sure that we can draw down invaluable funds, funds that we would use very effectively to make sure health care is provided in the most meaningful way. Health care, and particularly affordable health care under the Federal Act, we've been working on for a long, long time. In fact, as many of you know, San Francisco had a Healthy SF for a period of time, and working with institutions like NEMS and others that have been very effective in this, that we were able to really breach a lot of cultural barriers from the beginning. But we also know there are many jurisdictions throughout the state that were not able to do so and continue to struggle. We've got to make sure that health care is for everyone, whether they're seniors, whether they're immigrants, whether they're low-income individuals. And that's why this bill is important. I want to thank Speaker Pérez. He's always been at the forefront of not only causes that help improve the services of government, but he's particularly been helpful to San Francisco for a lot of years in his role as Speaker and as member of the Assembly. And this does not surprise me that Speaker Pérez would yet introduce again something that we value very highly. Take the example of what was referred to earlier as one of our greatest accidents that occurred most seriously last summer, the Asiana accident. And while we are still very much in the mode of condolences to the families and the individuals that died in that accident, we are internally and grateful to the medical services that were provided by all the different hospitals, and in particular, those that were provided here in San Francisco were culturally competent, and that's why many, if not all, of the individuals that ended up in the hospitals were able to survive. NEMS offers yet another example, and I know Supervisor Chu is very proud because he's a supervisor of this district, knowing the quality of culturally competent health care that's provided here at NEMS with the doctors. And Eddie, I want to congratulate you on your administration here. But we have to do more. We have to make sure, and as policymakers in the state, I support Speaker Pérez's efforts here specifically to address this, to address the gaps that exist throughout the state. And I know that it's more than just having language as a celebration of diversity, it has to be placed in essential areas where people's lives depend upon it, whether it's voting rights, whether it's emergency services, or whether it's medical services. These are essential areas where we've got to have it correct, and that's why this is important. I also must say that Speaker Perez's Tagalog is pretty good. Thank you.
Well, thank you, Mayor Lee, for your leadership and, of course, your support of this bill. And again, congratulations to Eddie and to NEMS. NEMS started as our community's response to a lack of cultural competence. We saw it as a need in the Chinese American, Asian American community to really have to provide services with translations, with doctors and nurses and staff that could actually speak the languages of our communities. And so we in San Francisco have traveled this road for many, many years. And I'm honored to sit here and support Speaker Perez's bill, AB 2625, because we are going through a major change in our healthcare system. We're going to be bringing in millions of people into the Medi-Cal system, many of whom are going to need assistance. Right now, we estimate that 1 in 5 residents in California speak English less than well, according to the U.S. Census. We know that about half of the enrollees in the Medi-Cal system, need some level of assistance with English. So imagine if you're in a foreign country and you get injured and you have to go see a physician or a nurse and you can't speak the language that they're speaking to you. Well, I actually held a hearing about this last August in San Francisco to really talk about many of the human stories that are really at risk. And what we heard is, no surprise, there was misdiagnosis, there was miscommunication, patients weren't being treated properly, they couldn't get access to translations. Many of them brought their young children, and I can't think of anything more awkward than trying to have your 7-year-old or an 8-year-old try to translate in your language, dealing with very technical terms or health issues. So this is something that's sorely needed, because we heard in our hearing that quite often this translation, being a bridge between the physician and the patient, was really a matter of life or death. And we've heard so often when people did get treated properly, there were serious consequences that people continue to live with day to day. I think oftentimes we in Sacramento and California, we can talk in such broad brush strokes and talk about the numbers, but there are people behind every single one of those numbers. And in every single situation where there's a misdiagnosis, where there's mistreatment, people have to live with those consequences. People have debilitating diseases. People have these physical ailments. So again, we're here today because AB 2325 provides a clear solution. It provides a clear need, and it doesn't really help to give people health care insurance if you don't give them access. Just getting insurance doesn't mean they're going to get care. The only way to guarantee that they can get care is that they can be able to communicate with their physician, with their nurse, with their healthcare provider. And again, that's why we're here today, because NEMS has done such an excellent model of providing that we really want to see that emulated throughout every single healthcare entity in the state. Thank you very much.
Hello， 各位記者各位重要嘅嘉賓，咁我叫婉婉，今日好高興可以嚟到呢度分享下我嘅故事。
My name is Yun Yun. I'm very honored to be here to share my story with you guys. Thank you very much.
咁諗起我個女女當時係9歲，咁而家都係2年前啦。咁佢喺學校嗰度咧，大概4點鐘嘅時候咧跌斷咗隻手。咁當時咧，我哋就去學校接咗佢，就嚟到東北揾個家庭醫生睇。咁佢就話：哇，隻手咁樣啊，斷咗喎！你要即刻去UC 啦。咁我哋就馬上車佢去到 UC。咁但係當時去到醫院嘅時候咧，就要填好多文件，但係所有嘅嘢咧都係英文。咁啊，只有揾我大少少嘅女兒，但係當時只不過係5年班嘅女兒，咁就大嗰個咧幫我哋講俾我聽應該點填啦，咁我哋就填咗啦。
Okay, it was about like 2 years ago, and my daughter, at that time, she was 90 years old. She broke her arm at school, and then we took her from school and then came to NAMES because that was our family medical service center, and then we we saw our family doctor, and then they sent us to UC SF when we were there, and the UC staff asked us to fill out a lot of forms. They were like English forms, and we were not able to do that because we didn't understand English.
咁喺嗰個期間咧，我哋都等咗好耐，都冇人講俾佢聽下一步點，咁啊跟住都等咗幾長時間，先去照 X-ray， 照完 X-ray 咧，跟住佢嘅先至再話哎呀斷咗2條骨啊咁，但係呢啲全部都係我個女翻譯俾我哋聽，完全都冇一個真正嘅即係醫護員係幫我哋翻譯嘅，咁我哋聽其實都係一啲咯，都唔係好清楚。
At that time, there was no translation, no interpreter provided. My other daughter, she was 5th grade. She was in 5th grade, and she was helping us translate and to communicate with the hospital staff. And we waited for a long time. Nobody came to talk to us. And then they took my daughter to take the X-ray. And then they couldn't provide information to us. And then our daughter had to help us to communicate with the staffer and to understand the situation.
等到差唔多凌晨3點鐘，咁啊先至去幫佢駁骨。咁駁骨個期間咧，我哋都想入去睇，佢哋話唔俾我哋入去。我哋話問點解？跟住我個女話：人哋醫生冇問你，你唔好再講啦。咁我個女有陣時又好攰，咁又唔知佢講。咁因為佢講個中文又唔係好明，講個英文出嚟又唔係好明，咁我哋只有喺出邊等。咁啊，終於咧等佢駁完骨，又等佢啲麻醉過咗啦，我哋先至可以入去睇佢。
So we waited until like 3 o'clock in the morning, and then at that time the doctor told us that they need to reset my daughter's arm, and then they took my daughter to the room, but they wouldn't allow us to go in. And then the other daughter was very tired, and she was not able to fully translate the information or communicate with the hospital staffers. And we waited until my daughter came out, and then she was asleep because of the anesthesias. And then also we was not able to be with her when the doctor was resetting her arm.
到5點鐘啦，佢麻醉過晒之後咧，其實我哋好想問醫生之後點樣咧，翻去點啊？佢話最緊要唔好濕水。我哋話咁點樣先可以避免唔濕水咧？如果濕咗水點咧？咁其實我個女都唔係咁明，去翻譯俾我哋聽，我哋又唔係好明。咁跟住只有咧就翻屋企咧去窩機買啲止痛藥，就係咁樣咯。
So the doctor told us that because my daughter had a cast on, and then was not able to have should not have any water contact. But at that time, we had questions like, how do we prevent not to have water contact? What if there was water contact? What we should do, but we were not able to get the information.
咁所以我覺得我今日咧可以分享呢個故事咧，唔係單單我係咁樣噶。我覺得喺移民嘅社區咧，係好多個人咧都遇到我同一類嘅故事，所以希望咧今日有咁嘅機會可以分享到咧，能夠幫下我哋唔係咁識英文嘅家庭。咁多謝各位。
I'm very honored to be here to share my story, because this is not only my story, this actually is the story with many immigrant families, and they had to rely on their young kids to do translation. I'm very glad I can be here to tell you my story.
Thank you.
Thank you.
We'd be happy to take a question or two.
Can I get a little more clarification on the funding? Is it existing federal money or new federal money, and then it'll impact the state budget a little?
It would be a drawdown of available federal money that we're not currently getting. So for every dollar that we spent, we could draw down an additional $3 in federal money. Other states have done this rather effectively, but no state has as great a need as California, with the 200 languages spoken here and the high proportion of folks that don't have the level of English language fluency that you'd need in healthcare settings.
Any estimate how many dollars?
We're still working on the exact dollar amount, but again, the 3-to-1 federal match is a very compelling reality as well, because it means that not only would the lion's share be covered by available federal funding, but it has additional money flowing into the state.
In practical terms, can you talk a little bit about what that means for hospitals and centers like this? Does it mean more interpreters actually going to grounds, or what?
Correct. It would mean in many settings more interpreters on the ground, and in some cases it would also mean translation services that would be available remotely. So when you have a significant language population, you'd have interpreters for those language populations on the ground in places that are appropriately, but remotely you could get access to languages that are less common in your setting, but also significant in the States. So for example, NEMS does a great job of having language competency for a variety of languages that are common in San Francisco, but if you had somebody that spoke Russian or another language that's less common here, you would then get access to those services remotely.
So if there's an emergency, say like Asiana Flight 214, you could deploy people right away out
You
to
could
the
deploy,
triage,
correct, you could deploy people physically, and you could deploy them electronically. And what we know for certain is, had the Asiana accident happened in many other cities in the country, we would have had a much higher death toll. The reality that there were so many providers in San Francisco who had the language skills necessary for a passenger base that was significantly Korean and Chinese really was the difference between life and death for so many people on that flight. Thank you all very much.